We are live on Instagram and YouTube this morning. So happy Saturday. I'm located in Des Moines, Iowa. Where are you guys listening from? It is absolutely gorgeous here in Iowa. There's not a cloud in the sky and the sun is coming up. It's so bright. It's crisp. And you guys, it's football season. I remember when I was a little girl, we lived for a very short time in Muncie, Indiana. And on mornings like this, we would get up, and we didn't live far from Ball State University. And my dad, my mom too, they loved football. So we had tickets to the Ball State Cardinals. I believe they're the Cardinals. And we would walk to the games. I'm sure it took us a long time with little legs like mine. But yeah, it just brings back just these wonderful memories. The leaves are starting to turn. And it's just beautiful. It's just plain beautiful. So good morning, you guys. Happy Saturday. And this is your opportunity to ask medical questions. I may not know the answer. I'll let you know if I do. I'm not going to make something up. I will do my best to help you get a grip, get some information on your health. And as always, I like to start out with just some information. Good morning, Tate, or Egg, or 93. Good morning, Lucy. So just to kind of get the ball rolling, I thought we would talk a little bit about insulin resistance and how you can tell. Oh, by the way, in case you guys are noticing, I am doing a little fundraiser for Midwest Dachshunds. So if you feel compelled, we're trying to raise $100. It doesn't have to be right this minute, but I want you to know that that is my live fundraiser. Midwest Dachshunds is obviously located in the Midwest, and you guys know how much I love dachshunds, so that's where we're at. Live fundraiser for Midwest Dachshunds. So if you can help, even if it's $1, I would appreciate it, or they would appreciate it, but yeah, I would appreciate it. Well, let's see. Okay, so getting started with insulin resistance. How can we know if we have or we know somebody in our life that may have insulin resistance and they maybe don't want to go to their doctor or they don't want to get blood work? Are there signs, just obvious signs, that they might have insulin resistance? Well, just from a looking standpoint, just looking at their skin. Oh, I forgot to introduce you to Tucker. Tucker is my co-host. You know how I remembered? The mirror was glaring in my glasses and it made me remember. So yeah, this is Tucker, you guys. And Tucker, my little soul dog, passed away in February of this year. And he's my co-host from heaven. So here he is. And yeah, we'll keep him close by and maybe not so much glare from his mirror on my glasses. So getting back, an obvious sign that we can see just by looking at the skin. If we see, and especially the neck, if we see like little skin tags are an almost obvious sign of insulin resistance. Another sign, and again on the neck, is something called acanthosis nigricans. Acanthosis nigricans is kind of a crepey, brown or hyperpigmented skin that is on the neck. And it kind of looks like a little chicken wiry. It's darker. It feels rough. And you might have seen this on people and now you're going to go, oh, I bet they got diabetes. If not, yes, I think they got insulin resistance. Lucy says, yes, insulin resistance. I read yesterday that one of the reasons insulin gets to send glucose into the cell for energy is because AMPK protein is dormant. Is this correct? I would have to look into AMPK. The insulin receptor is the GLUT4. I'm guessing AMPK, whether it's high or low, plays a role in whether or not that GLUT4 receptor can receive the insulin, which receives the glucose. So insulin basically knocks on the door to activate that GLUT4 receptor that is docked in what we call a lipid raft. So the GLUT4 receptor can't just come to the cell membrane. It has to have a specific place for that. And without that docking station, this lipid raft, GLUT4 can't get to the membrane to even be stimulated or activated by insulin. So the lipid raft comes first, the GLUT4 receptor to take in the glucose. Insulin is what's knocking on the door. How that relates to AMPK, I would have to look it up. But I trust that if you looked it up, and insulin doesn't get to send glucose. How else can we tell if, besides getting labs, how else can we tell that there's a possibility you could have insulin resistance? Elevated blood pressure. So hypertension, high blood pressure, hypertension, high blood pressure is a sign that people are insulin resistant. So insulin resistance can be a lead up, obviously. It's a sign of metabolic problems. And these metabolic problems are, shown in many ways. And, many doctors will just diagnose people with hypertension, high blood pressure, and they will call it something called essential hypertension. Essential hypertension or idiopathic means, we don't really know what the diagnosis is or what caused it, but here's your medication. But I'm guessing 9 times out of 10, it's from insulin resistance. Now, let's just say you are going to get some testing. When should we be getting testing? Well, I think that everyone over puberty should get a baseline. We're seeing insulin resistance. Yes, Lucy, skin tags and brown under the arms and neck. That is the acanthosis nigricans. That is that crepey dark brown, or depending on our skin color, the color of it. But it's that brownish, under the arms, anywhere where there's rubbing. Our neck is a huge indicator of insulin resistance. So if we are checking insulin levels, getting it before puberty is probably not going to help. Yeah, Carney, thrush is a definite indicator that we're feeding candida or fungus with high doses of sugar. So yeah, it's a possibility. I mean, when we see candida, we look to say, oh my gosh, could this person be diabetic? Especially a woman who's always got vaginal yeast infections, or people who have yeast infections underneath their, from skin on top of skin. The most likely cause is going to be insulin resistance or even diabetes. That's what I was getting to, Lucy. When we do test, getting an insulin level. Now remember that the insulin has a little bit of wiggle room, depending on the time of day that we're checking it. And so we need to take that in consideration, that there is peaks and valleys of insulin. So maybe getting it multiple times a day might help, but then again, that's gonna take you going back to the lab and getting an average. But one time when you wake up in the morning, your cortisol could be elevated and then cause elevated blood sugars, which raises insulin. Your insulin in the morning could look like 11, and then it averages 3 during the day. Doubtful that you have insulin resistance yet, but the insulin going up that high could be pathological. Now, what else can we look at to determine whether or not we have insulin resistance? We can look at, obviously, your insulin level. And 2, we can look at your triglyceride to HDL ratio. When we are eating a lot of carbohydrates, our triglycerides are going to go up. When triglycerides go up and they are over 1, or how do I say this? If the triglyceride to HDL ratio is over 1, your risk of having insulin resistance or metabolic syndrome is very high. So my level for triglyceride that I go by is 70. And HDL, I also want at the 70. Triglycerides rise and HDL drop the longer I'm on carnivore. I'm not sure how to explain that, but there could be something that you are consuming and calling it carnivore. It could be cheese, it could be dairy, heavy cream, things that are increasing your triglyceride level. Protein in general, like from steak or meat, barely, modestly will raise your blood sugar and then cause a spike of insulin. Your stress, maybe your stress of life is increasing your blood sugar, which is raising these things. It is possible that you could be one of the few that does get elevated triglyceride levels, but the HDL going down is a concern. You might want to increase your fat content, eating more animal fat, a 2-to-1 ratio, just raising your fat could help bring those ratios back down, or that ratio back down of triglyceride to HDL. So a great ratio would be 1 or less, like 70 of triglycerides, 70 of HDL. Remember, HDL is also increased by our exercise program. So exercise will raise it, and high fat diet will raise it. Also be very careful. With carnivore, most people will say that in order to get enough protein, they're using protein shakes. Those are free-form, denatured amino acids. When we throw that into our system really rapidly by drinking it down, there is going to be a rise in blood sugar. We'll get a spike of blood sugar, which spikes insulin. This also raises triglyceride levels despite it being a protein. But denatured amino acids, I do not recommend using protein powders as a source. It's a supplement, and you should not need supplements to, your diet should supply everything you need. Carney says, I used to get bad anxiety, anger issues, feeling faint before eating. It sounds like that you're having a sympathetic fight or flight reaction. That could be from low blood sugar, or you're just not used to it. Again, I would have to look into more about what your diet is. And, if you guys are ever wanting to consider a consultation, I would be happy to do that. Just email me at IronLadyDoc@AOL.com. You can also just message me through Instagram or YouTube, but really emailing me might get faster action. Let's see. Melissa says, what do you eat in a normal day? I have some coffee with some heavy cream to start my day, most days to start my day. And then I might eat 1 or 2 meals of some sort of meat and eggs, butter. That's basically all I eat. Carney says, why do people have protein powder when they could just eat steak? Well, I agree with you, but in their eyes, they either from a convenience factor or they actually think that protein powders are nutritious. They will choose the protein powder because it's easier. Again, I agree with you. I would want you to eat whole foods, the meat that I promote eating whole foods, and eating the steak over a protein powder is, much, much better. Protein powders are going to spike glucose. Free-form amino acids are going to do that, whether you know it or not. Just get a CGM, you can tell. So if we got insulin resistance, now we got to know how are we going to reverse this. One, I need you guys to understand that fat does not make you fat. Okay, so please don't fear fat. The biggest pillar that you can do to reverse insulin resistance is to lower your carbohydrates. Carbohydrates are going to cause elevated blood sugars more so than any other macronutrient, fat or protein. Even more so than those free-form amino acids in your whey protein shake, okay? So getting rid of or lowering your carbohydrates can reverse insulin resistance. I need you to prioritize protein. Don't fear fat. Obviously, get rid of carbs or make them very low. fasting, whether it's intermittent or prolonged fasting, timed fasting. Those are all, the thing about fasting is everybody could have a different definition. So you got to find out what works best for you guys. Exercise is also another pillar for reversing insulin resistance. What exercise? Well, I mean, the exercise you will do, of course. So that's important. So you want to choose an exercise that you will do and do it on a regular basis. But I think that the best exercise is going to be, hi Dave, thanks for joining. I appreciate it. Help me monitor over there since you're going to be there for a bit over there on YouTube. But the type of exercise that's going to give you the biggest bang for your buck is resistance training. The more muscle you have, the better your insulin and your blood sugar will be, because muscle is a hungry organ. It loves to eat, and it's going to eat the blood sugar. So if you are giving yourself blood sugar through carbs or free-form amino acids, like I mentioned before, or high cortisol levels that the liver is making glucose, the glucose can be elevated and causing insulin resistance. So having more muscle can help, level the playing field, so to speak. So HIIT, high intensity interval training, and lifting weights, increasing our muscle mass is going to be in our best interest. Those are the pillars. I'll review ways to reduce or reverse insulin resistance is lower or no carbs. Prioritize protein. Don't fear fat. Exercise and fasting. So hopefully you guys got that. Carney says, I have an egg drink for breakfast, 2 raw eggs, teaspoon of ghee, cinnamon, nutmeg, and clove with a cup of hot water, and blitz it with a blending stick so it is like an eggnog drink. So there's a recipe for you guys. Okay, just checking notes or checking. Here's a question that came in. By the way, I got these questions, many of these questions, from people who, when they watch my reels, they will question. And so I went through and actually wrote some of the questions down that would help maybe get the ball rolling. So if you have questions, please ask them. But I'm going by the questions that were written on my reels for right now. So a question came in, what do I think about diet soda? I can't tell you guys what to do, but if you just look at the ingredient list of a diet soda, that might give you pause. If drinking something that has a ton of chemicals does not bother you, then by all means, drink the diet soda. Does diet soda raise glucose or raise insulin? I guess it would depend on which sugar or fake sugar or natural sugar, whatever you want to call it, is in that particular diet soda. There's going to be some synthetic or some not sugars, so not pure glucose, not cane sugar, not that can raise, like maltodextrin or maltose or maltose or xylitol. Those can raise blood sugar and perhaps raise an insulin spike. What about allulose? Probably not. Stevia? Probably not. But I don't know if those are in all diet sodas. And you really maybe need to get a CGM, a continuous glucose monitor, or just check your blood sugars if you have a glucose machine. Just check it and see if the soda does raise it. But maybe more importantly, you want to know what does the sugar or what does the diet soda do to you? If you drink a diet soda and it doesn't cause you to go and eat something more, then it's probably affecting you less. But some people will drink a diet soda and just that sweetness will encourage them to eat something in addition to that diet soda. Not everybody, some people. And usually they will choose a high sugar content food. If that is the case, then you are likely the person that needs to stay away from diet soda. I mean, that just makes sense. Would I drink diet soda? No. Do I ever? Yes, I've had diet soda before. It's not something I would choose on a regular basis because I don't, one, like the way it makes me feel, and two, I don't want the chemicals in my body. I just don't. I try to stay, as chemical free as I possibly can, and that's just, drinking a diet soda is just an easy way to increase my risk of having toxicity. There was a question in this regards on aspartame and cancer. I don't know, again, do not quote me on this because I don't know. I don't know if there are any studies that conclusively show that aspartame causes cancer in our human body. Maybe in a rodent, but we shouldn't just paint a broad stroke and say anybody who's taking in aspartame is going to get cancer. Again, most people say the dose is what makes the poison. Well, I would ask you, what is the dose then? Is the dose different for everybody? Most likely. But if I told you that aspartame causes cancer, would it be something that you would continuously do on a regular basis? Are you going to put a known toxin into your body? Some people play Russian roulette and they don't care. Well, there's no study, so I'm just going to look the other way. That's fine. I mean, if that's the choice that you want to make that choice. But we don't have conclusive evidence in humans that aspartame does cause cancer. Now, over time, with 20 more years of studying aspartame, could you have cancer? Absolutely. Sheila says, no more Diet Coke for me. That's probably the best choice, Sheila. And again, you might choose a Diet Coke every once in a while, and that's okay. Marnie asks, is there any known truly natural chewing gum? I don't know of any. There's one called Pure, P-U-R, I believe, and I think they use xylitol. And xylitol, in all reality, xylitol can help with infections. It's like an antibiotic. It's an antibacterial. So if you're using xylitol in your toothpaste or xylitol in your gum, it is helpful for bacteria. But then again, do we have good bacteria in our mouth that we need that makes nitric oxide? And are we using xylitol and it's destroying some of those nitric oxide producing bacteria? I don't know. So I'm just cautious with, antibacterials, whether it be gum or mouthwash or anything like that. I don't know what kind of toothpaste you guys are using, but fluoride is also basically an antibacterial. That's why they put it in there. They'll say that it prevents you from getting cavities. Well, why? Because it's an antibacterial. That's why they put it in our water. It wasn't to make our teeth big and strong. No, that's your diet. That's protein and chewing and building strong bones and teeth with calcium and vitamin D. Right? You guys know this. Okay, so there's, in addition to this diet soda question, which ones here's the question, of these sugar alcohols or sugars do spike insulin? Or don't spike insulin. And I gave you several: allulose, stevia, monk fruit, erythritol. It's a newer one. These are not sugars that I would put in my body. I just stay away from it. Once you guys get rid of sugar, you're not even going to want it. The minute you start putting anything sweet, for somebody, maybe not me, but maybe you, the minute you taste something sweet, you're the wheels are off the bus and you're going to do it. You're going to continue to do it. And that is where the danger lies, you guys, is what does putting something sweet in your mouth do to you for the future, like future meals, or you know what, I'm just going to have one more Diet Coke, or it's not going to hurt me just to have some coffee with some allulose in it. Well, no, not at the moment, but what does it do to you for the future? You guys, come on, let's go with the questions. I might run out of all the questions that were written. I thought maybe you guys would have some input into this. Another question that came up is, what is time-restricted eating? And is it related to fasting? Yes. Time-restricted eating is, how I would describe it, is not eating between meals. So even eating breakfast, lunch, and supper is a form of time-restricted eating. Or you might say, I'm only going to eat between the hours of noon and 5 o'clock. So you have a 5-hour time window. You might eat one large meal, an OMAD, one meal a day in that time period, or you might elect to eat 2. But time-restricted meals or fasting just means that you're going to set aside a time that you're going to eat. And the remaining time you're not going to eat, which is called fasting. So time-restricted eating is a type of fasting. Do I think it is good for you, or is that something I would recommend? Sure. I don't know what your goals are. If your goals are to lose weight, you can lose weight with time-restricted eating. What if what you're eating also plays a role? If you're doing time-restricted feeding or eating, and you're eating all carbs, and you're eating it later in the day, your body is going to, the blood glucose level is going to go up. Your insulin is going to go up. And if you are not fat adapted, or you're not ketogenic, so you're used to eating carbs, your insulin level is going to stay elevated a lot longer than a person who is metabolically flexible. Meaning, this person who's metabolically flexible is using ketones when there's no sugar, and sugar when it's available. So depending on what fuel source is available, a metabolically flexible person can use ketones or blood sugar. Sugar, either from the blood, well, obviously it's going to be blood, whether you eat it or your liver makes it, but a metabolically flexible person can use both fuel sources. Which one will they choose first? If insulin is low, they are going to choose ketones. If insulin is high, they're going to burn blood sugar, glucose. Insulin determines what fuel is going to be used. If you spike your glucose level by eating carbohydrates, your insulin will go up and you will use glucose as your fuel source. If insulin is low, you will use ketones. You will break down fats, fatty acids, and you will break them down, and the result is ketone production. If you are metabolically flexible, I'm not promoting this, but if you were to every week or every 2 weeks, you go and have some carbohydrate meal, metabolically flexible, your insulin level will not stay elevated for very long. But if you're not metabolically flexible, your insulin level could stay elevated for 10 hours, not 2 or 3 hours, like a metabolically flexible person. So a little bit of rise causing a so-called insulin resistance for a short period of time, metabolically flexible, now the person goes back to using ketones as a fuel. But a person who's constantly got blood sugar that's elevated from constantly eating, that insulin level is going to be elevated for longer periods of time. That person is not metabolically flexible. Make sense? Does anybody have questions on that? Let me see. Bram asks if I'm kind of lazy doing any strength training and just do hand grip resistance training, so hand grip exercises, resistance, okay, for your lower arms, will that help reverse insulin resistance? Muscle is the organ of longevity. The more muscle mass we have, the less chances for insulin resistance. And with that being said, your little lower arm muscles, your flexor ulnaris, flexor carpi ulnaris, your biceps brachii, those, let me see who Bram, are very small muscles. If anything, you want to use the largest muscles. If you don't want to exercise and you have to choose an exercise that will be the biggest bang for your buck, choose the bigger ones. Your lats, so your back, your glutes, your quads, hamstrings. Those are the muscles you would want to exercise. So squats. So you don't want to go to the gym, just get a kettlebell, a heavy one, and do goblet squats, do walking lunges, do deadlifts. Work the bigger muscles, and your chances of having insulin resistance are lower. But, you know, you're worried about insulin resistance. You don't want to exercise. As you get older, you're going to lose muscle. It's going to atrophy. It's called sarcopenia. And you're just hurting yourself. You're hurting your bone structure. You know, I'm not trying to be, I'm not trying to be mean at all. That's the word I want to use. I don't want you to take this personally, but you're only setting yourself up for bone loss and sarcopenia in the future. And you're the kind of person that we're going to watch have a hard time getting out of your chair, getting in and out of your car, having bone fractures, breaking your hip. Do you want to do that? You know, I don't think you do, but are you so lazy? Are you that lazy that you can't take 15 minutes and do some lower body exercises or upper body lat and back exercises? I mean, if that is the case, then go for it. But if you want to increase your chances of staying out of a nursing home, decrease your chances of having a fracture, decrease your dependency on other people to help you get around, help get off the stool or your chair, I would work on lower body, extremity exercises. I would work on your glutes. I would work on your hams and your quads. I would do lunges and deadlifts and squats. Nancy says, does walking 3 miles a day help build leg muscles? No. You're doing prolonged exercises. It's just toning. You're just maintaining. But look at yourself. Like when you started walking 3 miles a day, just look at yourself. All right? Look at yourself in the mirror. Say you've been doing it 3 years. 3 miles a day for 3 years. Look at your legs and your body 3 years ago, and now look at it now. Do you have decreased muscle mass? I'm guessing you do. Look at your butt. Is your butt getting flatter and flabbier? Are your quads getting flabbier? Can you even see a hamstring? So no, you're not going to barely preserve your muscles by walking. Now, there's a suggestion, walk with a weighted vest. Okay, Well, you can walk with a weighted vest, but then your body's going to get used to that. And you're going to get sarcopenic in the future. The only way that you can stimulate growth of muscle is by working the muscle with resistance. If you just do 3-pound exercises for the next 3 years, you're not going to build up muscle. It's deteriorating. Your muscle, you're going to get increased myostatin. That's causing deterioration of muscle. You're feeding yourself less, usually, as we age. We're not getting enough protein. It's taking over and above as we age more protein. When we're little, we could just use 50 grams and build big muscles. But we can't do that. We have more problems with breaking down our muscle than building it up. So it's like a teeter-totter that's on the breakdown side of things as we age. And so if you just want to continue walking, I want you to walk outside, of course, be in nature and suck up what God's nature has done for us. But you're kidding yourself if you think that, walking 3 miles a day is going to preserve anything, even with a weighted vest. Nancy says, got it, back to goblet squats and walking lunges. Put a kettlebell in both hands and do walking lunges. Stand in place and do lunges. Do squats. Do squat to press with the goblet, with the kettlebell. It's just so important. And continuously strain yourself. You don't want to just do 10 easy reps. No, you need to go to failure. You need to test yourself. You need to push beyond. It increases your stamina. We need to push ourselves, you guys. Nothing is easy. There is a question about metabolism and repeat the metabolic flexibility. Okay. When a person starts to lower the carbs, they're decided they're going to do a low carb, moderate protein, high fat diet. Okay. The person over time will start using fat as a fuel source. In the presence of low insulin, that means low carbs or low blood sugar, you can start using fatty acids, your fatty acids, to make ketones. And you will use those ketones as your fuel source. When you do this low carb, moderate protein, high fat diet for months and months and months, you become keto adapted or metabolically flexible. And it takes time. That means that your body will use these ketones as a fuel source. Now, if you've been doing this 6 months, 9 months, 12 months, and you happen to eat a baked potato with your steak one night because it's your birthday, you are metabolically flexible that you can shift over, use that glucose from that potato, raise your blood sugar, raise your insulin, and then within an hour or two, blood sugar comes down, insulin comes down, and you're back to using ketones. That is metabolic flexibility. But if you are a person who eats carbs on a regular basis, you never get into ketosis. Maybe, but I'm doubtful that you could get into ketosis after 12 hours of sleeping at night, which many people don't do. And you check your ketones in the morning, they could be elevated. But usually this person breaks their fast with toast and cereal. And so they were never really metabolically flexible. When the blood sugar goes up, their insulin goes up, and it will stay elevated for much, much longer time periods. That's metabolically inflexible. They're never allowing themselves to go back to using, or to start with, to use ketones as a fuel source. They're constantly needing to be fed carbohydrates or blood sugar in order to fuel themselves. That raises blood sugar all the time, raises insulin, and is basically just causing obesity and fatty liver, metabolic syndrome, which leads to diabetes, if not already. So Marnie, thanks for joining me over here. Apologize for anything over there, but you know, there are people on YouTube who truly want to listen. Ranting Raccoon asks, do I believe in fasting? Whether I believe in it or not shouldn't matter. But why do you want to do fasting? That should be the question. So you ask yourself, why do I want to fast? Do I want to fast to lose weight? Do I want to fast for religious purposes? Do I want to fast to be in metabolic flexibility? Fasting is very important if we're looking at autophagy. If autophagy is occurring, that's basically maid service for your cells. Autophagy can occur when we're in ketosis. So you could be carnivore, you're in ketosis, and you are going into autophagy. Is the autophagy as much as would occur if you didn't eat at all? I can't comment on that, but logically, you might think that fasting would cause more autophagy than simply being still eating and being in ketosis, because I think there's still a little bit of blood sugar rise with protein. And so autophagy would occur more. Go lay down. Go lay down. Talo's just standing there looking at me, and he doesn't know what he wants to do. He's very timid still, and he doesn't know whether he should lay on the rug or go lay on one of the beds. So he disappears, and I just need him to relax. He can be so nervous. And I think he notices I'm talking to you guys in a box. I can't see you, but you can see me. He can see me talking, and he gets a little worked up. And it will get better. He's new to me, and he's my rescue. That's why he's part dachshund. We think he's part whippet. So he's a whiphund is what they call him. And yeah. Lucy says she's going to go check her blood sugar right now. Nancy says, how can you safely fast with a BMI of 19? Well, I don't give too much credence to a BMI, because you could have, low muscle mass and a low BMI, and a high muscle mass is going to raise your BMI. If you don't have muscle, Nancy, that's the first thing. I really don't care about your BMI, but if you don't have muscle, that is going to be a problem. You're sarcopenic, and as you age, muscle is the organ of longevity. You need to eat to maintain your muscle mass. If you can't eat enough protein and fat at your 1 or 2 meals, then I do not suggest you are a fasting person, because you're going to cause even more muscle loss and more bone destruction. You might be the person who cannot possibly eat enough. You might stop at 2 eggs and call that your 1 meal a day. You are not going to be able to supply your muscles, your bones, or your brain, or any of the other vital organs. So 1 meal a day or 2 meals a day and fasting might not be for you. You have to take into all of these things into consideration. But just looking at your BMI tells me nothing, okay? It might tell me just a little bit is you have no muscle. And so would I encourage you to fast? Probably not. Eve says, at what age does bone and muscle start to change? Well, it starts to change after puberty. After about the age of 21, we really stop producing more and more cells, pleomorphic, or being causing hyperplasia. more and more cells being made or formed, we kind of stop that at about the age of 21. Now, Eve, I'm guessing that you're female. And so, Eve, you're going to get more preservation of your muscle because of your estrogen. Now, we need to take into consideration that when we become menopausal and we're decided we're not going to do hormone replacement, that lack of estrogen now puts you in a position where muscle is going to be much harder for you to preserve. It is very important that in a menopausal state, we increase our fat 2 to 1 in most females, fat to protein. You need 200 grams of fat and 100 grams of protein. It's very important. But unless you are exercising your muscle, you're going to be losing it after the age of 21, 24, somewhere in there, 25 years old. It's going downhill. You have to stimulate it. I exercise every single day. I lift weights almost every day. There's a couple, maybe a day or two, I will take off and let my body rest. I might still go for a walk or do something just to get outside and be in nature. I try to stimulate my muscles to failure. So I will do leg extensions to failure. It hurts. It has to hurt. It encourages me to be tough, to withstand, to have stamina. It's very important to me. It may not be important to you, but just that amount of stamina helps my cognitive function, helps my focus, helps my ability to withstand tiny little bits of pain, like a mosquito bite, going outside in the cold weather. We are 72 degrees people who have never been in a life of deprivation. We live in prosperity and abundance. I hate to be the bearer of bad news, but none of you, well, some of you, many of you have never experienced deprivation. You've never really deprived yourself of a meal or of shoes or of fancy cars or whatever it is. We live in abundance and prosperity in America. Sometimes practicing a little deprivation, like going 12 hours without eating. Some people have never experienced going over 4 hours without eating. I mean, I can't even imagine. They go on a walk and take a protein bar with them, or some sugar drink, or some amino acid drink. You guys, we need to toughen up a little bit. You do not need to eat while you're on your walk or your hike. That is pure silliness, okay? If you're a type 1 diabetic, you can kind of disregard a little bit of what I'm saying, but we need to talk in a consultation and I can explain myself. Well, I guess it's not really a question. From raw meat eater. Most people eat meat. What does that mean? I mean, what percentage? I don't know. I truly believe that there are a lot of people out there who do not eat any animal sources. I tend to believe or tend to speculate that there are more people who don't eat any meat than do. Now, raw meat eater, you might disagree, and I'm not here to try to, it's just from the experience that I've had talking to my patients for 27 years. It is, and when I say eating meat, they might say they eat meat, but when you question them, they will say, well, maybe once a week or once a month or twice a year. And that I would not really consider meat eaters. They're not consuming any chicken, any pork, any turkey, any red meat, whether that be a ruminant red meat like cow, sheep, deer, lamb, elk, bison, buffalo. They're not eating any of that. I would agree that if they're not eating meat, they are eating some sort of plant or multiple plant foods. And yes, I tend to agree that eating plants and seeds, which are from plants, grains, legumes, nuts, roots, stems, leaves, flowers, yep, all of that is a plant. Those are inflammatory. I tend to agree with you. If you are a meat eater and you eat those things in addition, they're still inflammatory. There's nothing about the meat that is going to decrease the inflammatory nature of whatever you put with it, i.e. a plant. In fact, your $25 ribeye steak goes from $25 down to about $5 if you put a plant next to and eat a plant like asparagus or broccoli or whatever it is, your little cloves or whatever you're eating, your legumes, whatever it is going to decrease the absorption of your $25 steak down to about $5. So I personally don't want to waste a $25 steak by putting a plant next to it. Now, what do I mean by that? There's enough oxalates and phytates and tannins and hundreds of other chemicals in plants that may not kill you right now, but the inflammatory nature is what is aging you. Why are you aging? Because your body's inflamed. Why? Because you're eating and consuming inflammatory things. Over time, if you're okay with it and you don't mind aging and you don't mind getting chronic diseases, then eat your whatever next to your $25 steak and waste your money. My steak is more important to me than eating some crappy plant next to it that gives me nothing. Because of the anti-nutrients in a plant, I'm not going to waste my energy trying to feed my bacteria the sugar that's in, because I don't have cellulase enzyme. I'm not going to break down the cellulose that's in plants. I can't do that. Yeah, but it's good for your bugs. I don't have bugs in me that eat the plants. So why am I going to build up a bacteria that I don't need in order to survive by giving it some crap that has anti-nutrients in it? And it's not people say you are what you eat. I don't think that's true. We are what our bugs eat, our microbiome. My microbiome eats steak and eggs and butter. Somebody else's microbiome might love kale and spinach and broccoli. But the person is not eating them, their biome is eating them. And the biome is trying to extract nutrients, which may or may not be there. And they're trying to use the anti-nutrients. There's more anti-nutrients in plants than there are benefits. Now you could say, Dr. Jensen, I hear you. And you know what? If you're humble enough to say, I agree, there are anti-nutrients, but what I'm going to do is I'm going to cook my vegetables to the point where the oxalates and the phytates aren't as harmful. Then yes, I would agree with the plant eater who's going to cook their plants appropriately to help avoid not all, but many of the dangerous anti-nutrients. So yes, please, 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 if you eat plants, cook them. Do not eat them raw. They're worse raw. But everybody, I don't really care what you eat. I'm not going to get on my bandwagon and go, rah, 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 you guys eat carnivore. You choose what is good for you. I know plant people in my consultation and in my personal practice, my family practice, who only eat plants. They're vegans. And honestly, many of them are just vegetarian and they don't eat much animal products at all. They might eat a little cottage cheese or an egg here and there, but they mainly eat plants. Not all of them are diabetic. Not all of them are getting sarcopenia. But again, I haven't known them long enough, just like I haven't known a carnivore long enough to see what the repercussions are. So please don't hear me saying that I'm just pushing for one diet. You might feel awesome on a plant-derived diet. Okay? then I'm happy for you. Because when in all reality, any diet besides a standard American diet is going to be better than a standard American diet. A carnivore diet's better than a standard American diet. A vegan diet is better than, or plant-based, let's just call it plant-based so we don't, but a meat or an animal-based versus a plant-based. So a plant-based person is still in a better shape than a standard American diet person. So please hear me on that. But no, what I choose to put in my body might not align with you, and you have to make these decisions. But I do want to inform you that the nutrients or anti-nutrients in plants need to be dealt with, okay? Let me see. Lucy says glucose is 94, ketones 0.1, not in ketosis. Well, you could be, Lucy. You could be in ketosis. You're using your ketones. See, many people think that their ketones have to be this 5 level. Then I would say to you, if you've been eating carnivore for a year or more, you should not really have any ketones in your body because you're using them all. If you still have ketones in the 5 level and you've been carnivore, you're not being carnivore. You have blood sugar. You got to start eliminating things in your diet that is raising your blood sugar level enough that you can't get into ketosis. And even if you're in ketosis, you're not using the ketones. You're just spilling them in your urine. Well, I would want to use them because I need that fuel for my brain. I don't want them to go out in my urine unless I'm going to drink my urine, which in times of need, I may have to when there's no water. Brenda asked, is there a blank quiz to how much protein we need in a day? Is there I don't know what the answer or the question is, but do we need a certain amount of protein in a day? Is there like a certain number? No, I can't tell you that there is a certain number that we need to get in a day. I want you to eat enough protein that you're not getting sarcopenic. If your muscle mass is going down, you're definitely not eating enough protein and fat. I would say if you're exercising, this is just going to be a generalization. This is not, please don't take this as written in stone. But if you are exercising, you're lifting weights, I try to get a gram per pound of my body weight. So if I weigh 130 pounds, I want to get 130 grams of protein. To me, for me, that is easy. That is easy. What may not be as easy is getting enough fat. I strive for 200 grams of fat a day. With the fat and the protein, I'm able, one, to slow down any blood sugar that might be in that steak or ground beef or elk, bison, buffalo, deer, sheep, lamb. The fat helps that protein be absorbed more. And so I strive to not just simply eat protein, I need that fat. And especially if you're menopausal, you definitely need that fat for hormone production, for vitamin D production, for your brain. As we age, we need more fat. Men at least get a 1-to-1 ratio. If you're not exercising, which I want you to, please don't take that as it's okay you're not exercising and you're not lifting weights, you need at least 100 grams, I think. Okay? Raw Meat Eater says stress equals aging of the body. Absolutely. I mean, we need, hear me out again, cortisol is not the villain. We need cortisol or we won't live. We just have too much cortisol and it's chronically elevated. If it went up and then back down, great. But it's going up and it's staying up. We are constantly under chronic stress. We're doing it to ourselves and we're not practicing anything that helps to bring that fight or flight system in our body, the sympathetic nervous system, it's always elevated. It's always on edge. We are not allowing it to come back down. We're constantly activating stress, sympathetic nervous system, cortisol, blood sugar, insulin, all go up. And we're doing it all day long, even into the night. And you ask yourself why you can't sleep. Oh, I'm just an anxious, my mind won't shut down. It won't shut down because you're chronically stressed. You're chronically activated. You're chronically in fight or flight. You can't let it go. So these people really need to practice parasympathetic exercises. You need balance. We need to lower sympathetic tone and increase parasympathetic tone. Look up vagal nerve exercises or parasympathetic nerve exercises. Good comment. I appreciate that. Yes, exerting the body is extreme stress, but raw meat eater, I exercise and then I don't exercise. I don't think there's anybody out there who is exercising 24 hours a day and that is their extreme stress. I'm guessing that's what you meant by exerting your body. So I'm talking exercise. But a person who is doing ultra runs or marathons or running on the treadmill or running outside, continuously doing prolonged cardio, that is stress on the body. You're activating your sympathetic nervous system. You're activating mTOR. It's never coming down. You're increasing blood sugar. You're increasing insulin. It's not coming down. And you are a metabolic mess and you are causing advanced glycation end products and you're aging. You are aging yourself faster. Runners are aging themselves faster. Their skin shows it. Their face shows it. Everything. They might have muscle tone and they got a 6-pack of abs, but they're aging before your eyes. If that's what you want, go for it. I'm not, it is your body, but I just need you to know that all of these things from chronic exercise or chronic eating, let's just say you're chronically exercising and you're chronically eating. You have muscle mass, you're accepting it. But every time you take a bite of food, I got to eat multiple times a day in order to keep my blood sugars up and do this and that, then you are always in a state of mTOR. mTOR is a growth type of chemical. If you are constantly growing, you're constantly aging, and you are at risk of cancers. You want to grow cells when they want to grow, and then you got to turn off the switch and allow autophagy. If you are constantly eating and constantly under stress from doing cardio or long distance running or ultra runs or whatever the thing might be, constantly doing, if you're lifting weights 24 hours a day, you're constantly elevating mTOR. And AMPK, whatever Lucy brought up, I'd have to look into that. AMP kinase, yeah, I need to look into that. Like, does it go, I told you I was going to do that and I never did. I actually forgot. Does it go up or down when mTOR is up, when insulin is up, when stress is up, when cortisol is up? I don't want to be in that state. I don't want to age that quickly. I don't want chronic disease. Those things are leading to chronic disease. Yeah, but I'm in good shape. Right now you are, and you are the person who is going to have problems in the future. What are your thoughts on a rebounder? I think that you should, if you have a rebounder, please use it, or a mini trampoline. Yes, it is increasing your lymphatic flow. But Lucy, you need to stop eating carbohydrates. You need to stop feeding bad cells in our body. You need to fast. I'm not, right now, in my stage of my career, in my life right now, I could actually tell you, I am not going to do chemo. It is poison. It is toxic. I will starve that little sucker. A tumor is a defense mechanism. I truly believe that. It is walling itself off. It is a toxin that I put in my body, maybe over time, maybe over the last 40 years. I put toxin in my body and eventually it got too much that my body could not take care of it. Carbs, alcohol, smoking, too much exercise, diesel fumes, heavy metals, eating on the ground, whatever it is of the toxin that overwhelmed my body. Now body says, oh my gosh, There's so much coming in, I can't take care of it. I'm going to wall it off. I'm going to wall it off in my brain or my lung or my colon or wherever it is. My lymph nodes, that's walling off. That is tumor. That is a defense mechanism. And then what we do is we go and poke a sleeping bear and suck some out and go make a diagnosis. If I ever notice something going on in my body, I'm going to stop eating now. Stop eating. I'm going to fast. I might fast for 21 days. I might fast for 30. You can do that, Dr. Jensen? Absolutely. Trust me, my body has enough fat on it that will get me to survive 30, 60, probably 90 days without eating. I might add in a little bit of dandelion water or some key lime water. That's it. Maybe some electrolytes. But after a certain amount of time, our natural internal body water will start being produced. I will use my fat on my body, free fatty acids, and I will make ketones. Cancers cannot survive on ketones. They can't. They will starve. Don't believe me. Go look stuff up. Listen to Dr. Seyfried. Listen to these cancer doctors, the ones that aren't so high and mighty on chemo. But we've seen, I have 2 patients where their cancers, they did not do anything. I told them to fast, and I told them to, when they do eat, to eat carnivore. So when they do eat, now granted, these were skinny ladies, and they did lose weight. But then it leveled off. They didn't just keep losing weight until there's nothing to them, but they might have lost 9 or 10 pounds. Part of that was pathological water inside them, dangerous fat or dangerous water that was accumulating. But that's just me, and that's I'm no longer bamboozled by going to these doctors who make tons of freaking money on chemo. That's poison. The nurses don't want to touch it. I mean, they're all dressed up in basically body armor so they don't get exposed to it. But yeah, we look at cancers as some scary thing when we should be thanking our body for getting the cancer, the tumor, to wall it off, because without that walling off, you would be dead by now. So Lucy or whoever might be dead by now if they didn't get that tumor. The toxins would have overwhelmed you to the point where you just would have, your heart shut down. Bam, done. But you were blessed, you got a tumor. But then we run to the doctor, we run to a diagnosis, we get poked and prodded and surgerized. Oh, we took the little lump out? No, you didn't. You basically went in, you poked a sleeping bear, and there's more walled off cells. Not yet, not right now. Oh, everything is my normal. My PET scans, CT scans, they're all negative. I'm cancer-free. No, you're not. No, you're not. That just gets people to continue feeding themselves with the crap that caused it. All the toxins, all the smells in the air, all the heavy metals, all of the synthetic vitamins, all of the Cheerios and the cereal and the oatmeal and the plants. All that grew in the ground. And then you eat the leaves and you eat the fruit. The seed of the fruit, the babies. You're eating the babies of that plant, the fruit, full of sugar. And the toxins. Oh no, it's organic. You stop the air and the water from the rain falling on those things? I mean, that would be awesome if you could actually do that. You put an umbrella around it and you gave it reverse osmosis water? Great. Then what about the sun? Did you take the umbrella away, let it get some sun, and then put the umbrella back? I mean, I don't know. And does the toxins fall to the ground and hits the umbrella and just falls off to the side? Or is there some that can get by the wind and go phew, right into the plant? I mean, you guys, these are all the things that we're when you say organic. Now, again, I'm going to choose, I don't want the farmer, whoever's growing my stuff, I don't want them to be spraying the grass my cows are eating or my deer. No. So that's one thing I can check off and say, well, at least the person who raised my cow didn't, spray the grass. But he didn't stop the air from blowing heavy metals from 2 miles away. These are just things that we need to think logically about. But yeah, the more and more I think about these things and what the mechanism of a tumor is, we get lymph nodes and, when we're sick, And we go, oh, I just got some lymph nodes, I got an infection. Well, yes, but those are toxins accumulating in there. That's doing a job. And so we go to the doctor, and they give us an antibiotic to kill bacteria. That bacteria and every other bacteria kills your bacteria in your biome. Even my carnivore eating bugs, I go on an antibiotic. I'm at a disadvantage for the next 2 weeks because it takes another 2 weeks for the biome to grow back. We go to the doctor and they make a diagnosis via a diagnostic test. Yeah, but isn't that a good thing, doctor? I don't know. But really, when I start thinking about it, no. Why would I need to go to the doctor? Because I eat crappy, I live crappy, I don't exercise, I don't get outside. They told me to stay out of the sun, I put chemicals on my skin. Then you might need a doctor. You're the one that's aging quickly. But if you're eating an animal-based diet, you're living in nature, you're not smoking, you're not drinking, you have happy people around you that love you and you love them, you have dogs, you have a house, you have these things, you're living a life. I don't want you to go to the doctor. The tumor is walling off toxins. And if you stop feeding it, it will shrink down. Then there won't be further toxins. It will dissipate. Your body will be able to take care of itself. Unless, of course, you've damaged your immune system by over years, then we got a problem. Your immune system is not that great. How do you get it better? Stop inflammation. Change your diet. I don't know. These are the things I think about. I could be, you know what, you could say, Dr. Jensen, you're kind of off the wall right now. That's okay. Did I get you to think? I might have gotten your brain to activate for a second. You had to actually activate it and say, oh, she's wrong. Well, that would mean something else is right. So then you had to use your brain to think something else must be right. So keep using your brain. I'll keep just chit-chatting. You guys love that. Eve says, what are your thoughts on fibromyalgia? I mean, it's a diagnosis of exclusion. We can't even diagnose it. You got muscle pain. You know, you have pain all over your body. You have trigger points. Why? You're inflamed. Stop eating. Stop putting inflammatory foods in your body. Stop poisoning yourself with alcohol or cigarette smoke or no exercise or not getting outside in the sun. Fibromyalgia is just one more defense mechanism saying, oh, Eve, if you would only just stop, I don't have to keep giving you these signs. It's a sign. It is a symptom of something going on in your body that's broken. And you're just looking at treating I'm going to take some, it's from Lyme. How did you get Lyme? Well, a tick bit me. Well, you know what? You can get it without the tick bite. It's just Lyme. What is Lyme? Bordorphia, whatever it is? What's it feeding on? Well, it's feeding on your diet. And it's feeding on iron overload. Well, how did you get iron overload? From your diet. From your crappy processed diet for years. From taking synthetic vitamins. From being bottle fed as a baby. You have iron overload. Everybody probably has iron overload. It's destroying you. And viruses live on iron. And bacteria live on iron. And fungus lives on iron. And guess what else lives on iron? Cancer. It's a food. Iron is food. Sugar is food for all of these things. And so I take it away. I get rid of the iron. I need iron, just like I need some cortisol, just like I need some insulin, but we're getting exposure in high amounts. And if you got one heavy metal in your body, you likely have multiple. I mean, you have been eating out of the ground, right? You've been eating your plants that grow in the ground. The air and the water and everything that rains down on them is raining all these heavy metals down. The glyphosate. All of these things are in your food. I also eat plants. I do. I eat plants. Besides my coffee, I eat other plants. How? Only when they are filtered through a cow. Not even a chicken. I'm going to choose their eggs or, pasture raised. But the only other way I am going to eat plants is as long as they are filtered through a cow first. Cows have multi-chambered stomachs. They can deal with these things better. They can break down the cellulose and use short-chain fatty acids and make protein. I'm going to eat the cow. It's fat, it's muscle. I am not going to eat plants out of the ground. Monogastric animals, chicken, turkey, pork, pig, I don't eat them as much. I don't eat fish as much. Also, although somebody, a friend from the gym, gave me some catfish, and we ate catfish for a week. It was delightful. It was from the wild. Yes, our waters are contaminated. I don't eat it very often. I might not eat catfish for another 6, 7, 8, 9 months. Who knows? No, I'm not going to eat it on a regular basis. I'm going to eat ruminant meats on a regular basis. I'm going to eat their fat. I'm going to eat butter and ghee and tallow. That is what I eat. It is my choice. I don't care what you guys eat. I just need you to know that what you're eating, what it's doing to your body. Madge says, keto for the win. Yeah. You guys over on YouTube, there's a lot of stuff coming through. I can't get to it all because there's a lot of stuff in between that's not worth really reading. So I basically just flipped through all of these things. And so if you had a question in there, I'm going to the very end. So if you have a question, dude says, do you eat fruits? No, I do not. I do not want the sugar. That's basically glucose and fructose. And I don't want that in my body. I don't want fatty liver disease. Fructose is a surefire way of getting fatty liver, along with the iron that's inside that liver too, all pent up. Lucy, she is doing great. I appreciate it. Thank you. And I will tell her that you said hello. Melissa says, what are your thoughts on salt? If you like salt to taste, if I do salt to taste, I use Baja Gold salt right now. I used to use Redmond's, I stopped. I used to use Celtic, I stopped. I do like Meldon salt, and I like Jacobson's kosher salt as well. Oh man, Jacobson's is so good. But Baja Gold right now seems to be a clean. Lucy says to the other Lucy, I have been jumping every morning, little jumps, and use a dry brush, but I want one of those trampolines maybe for Christmas. I think that's a great idea. Anytime we are increasing lymphatic flow, we are going to be healthier. Dude says green bananas aren't as sugary. Okay, so just let me teach you something right here. If you choose an unripened fruit to eat, yeah, I agree with you, it's not as sugary. But you also picked that fruit before it ever had a chance for all of the toxic chemicals to get out. Let me try to explain this to you. When we eat a fruit that is fully ripened on the tree plant, whatever it is, all of the toxins that were in that fruit, the baby, actually went back in through the leaves and down into the root system and back into the ground. If you pick that fruit, that seed, unripe, you just trapped all of the chemicals from the ground in that, and you're going to eat it because it has less sugar, but it has more toxic chemicals. So go for it. But I would not choose to do that. So no, I don't eat fruits. I haven't eaten fruit I bet I haven't eaten fruit since high school. As you know, prices are high. Can I get proper nutrients eating ground beef and eggs? Absolutely, David, and butter. You know, I do not have, even with organic and grass-fed, I don't have access to that all the time. And I'm not going to spend, David, personally, I'm not going to spend $20 a pound for ground beef to make sure it was pasture raised. Sometimes money limitations, I might only get store-bought ground beef. I actually love ground beef. In fact, if I had a ground beef steak and a ribeye steak and I had to choose between them, 9 times out of 10, I am probably going to choose the ground beef steak. I don't know why. I love ribeyes, but I really love ground beef steaks. It is delightful for me. And I eat a lot of eggs. Now, I do choose pasture-raised eggs. I have easy access to pasture-raised eggs, and I'm going to get it. I'm going to eat pasture-raised eggs, and I do spend the money for grass-fed organic butter. Did she answer my question about MS and memory? No, I just skipped to the end. So whoever had questions back a ways back, because I'm not reading all of these comment things in here. If you have a question, put QQQ in front of it, and I will look at it and see if it will, be readable. Corey says, I rotate my cattle and goats daily, and it's helping with the worm load. It seems to cut down on the animals foraging in the waste. Well, from a regenerative standpoint, I want those animals, and I'm glad you're rotating them because they need food. And yeah, I think that's awesome. But all the microenvironment that we've destroyed with monocropping is being replenished. Hi, Mike. Thanks for being here. And Minister says, love from Chicago. Thanks. I'm in Iowa. Let me see. Bram says, can you explain more about anti-nutrients in plant foods? Anti-nutrients, there's hundreds of different plant anti-nutrients, okay? Certain plants have let me give you an example. Latex. Latex is a plant that produces a gummy, sticky, plants don't want to be killed. You don't want to be killed. Plants don't want to be killed. Lions don't want to be killed. Plants cannot run from us. Plants don't have teeth and claws. They don't have guns. They don't have anything that they can use except a chemical, a toxin, an anti-nutrient. So if Bram, you're not going to go out into the wild, right? You're not going to go out in the wild and just eat a plant. Because you've been told they could be poisonous. They are. All plants are poisonous. Yeah, but the ones in the grocery store aren't. No, they're less poisonous. It's going to take more time for that poison to build up in your system. For instance, one patient started doing spinach and kale smoothies. 30 days later of doing spinach and kale smoothies, they were deathly ill and in the hospital with humongous calcium oxalate kidney stones in acute renal failure from grinding up oxalates and phytates and probably some tannins building up in our system raw quickly 30 days. Whereas if you eat something poisonous in the wild, it might have killed you in less than 20 seconds? We don't know. But you are bamboozled to think that the plants that are fake, made in a lab, broccoli, there is no such thing. It was made. It never has grown in the wild. You don't go out in the wild and say, I'm going to look for some wild broccoli. No, it was an invention of man to make something less toxic, less killing force until 20 or 30 years. Or in this guy's case, he almost died in 30 days. Oxalates, phytates, tannins, those lectins are in plants. They are anti-nutrients. They block the absorption of nutrients, anti-nutrient. So phytates, oxalates, they block nutrients. They block absorption of B vitamins. They block the absorption of iron and zinc and selenium and amino acids and calcium and magnesium, all the positive charged ions. Those anti-nutrients block them. That's why I said your $25 ribeye with a side of asparagus just made your ribeye worth about $5. If you're okay with that, great. Lady B, tell me what your question is regarding MS and memory. Like what are you getting at? Hope and advise. I don't understand. Are you telling me you have MS and you have memory problems? Because I will tell you that all brain disorders will respond to ketones. Even if you never changed your diet, you're going to eat a standard American diet and you added ketones to it, those ketones are preferred for your brain. Your brain, no matter if there's sugar involved, will choose ketones as long as the ketones are available. But wouldn't you, instead of just giving yourself some exogenous ketones, wouldn't you just go into ketosis and use your own and stop the sugar, which is causing the inflammation, which is causing the MS? All of these neurological brain disorders, whether it be schizophrenia or depression, migraines, Parkinson's, MS, all of them, bipolar, all of them are inflammatory changes in our brain. They're not getting the food. All you're doing is feeding them full of carbohydrates, which is inflaming your brain and your nerves. And you take it away, and now your body starts making ketones, and now you thrive. You won't have memory. You won't have memory without oxygen delivered to your brain, without iron, without B vitamins. So stop the anti-nutrients. Get into ketosis, or worst case scenario, just add exogenous ketones. Go buy some. But your MS is not causing your memory problem. The crapola diet or your exposure to toxins is what the cause is. Get to the root cause. Bram, hopefully that gave, that answered your question. Raw plant salad is an anti-nutrient. It absolutely is. It's raw. It has no nutritional value. You're just poisoning yourself. But maybe for you that the amount of poison won't affect you until you're 100 years old, and you will have said that the risks outweigh the benefits outweigh the risks. And that's okay. Lucy says, Brenda, this is what I do. 1 gram per pound of ideal body weight. I'm now 137, but want to weigh 120, so at least 120 grams of protein per day. I can get on board with that, Lucy. Yep. So if a person is 200 pounds and obese, and you are asking, the 200-pound obese person is asking you how much protein they should get, I'd say, what do you think your ideal body weight is? Well, it's probably about 140. Then eat 140 grams of protein, lift weights, and get about 200 grams of fat, saturated fat, animal fat, not plants. Brenda says, Lucy, thank you. Good. Marnie says, taking my dog off of carbs and Fenben reduced his tumor. He is healthy now. Only meat for him now. Good. Marnie, this was a learning experience, and praise the Lord that Jax's tumor grew so fast, and praise the Lord that you had people in your life that could give you guidance and counseling on what to do for Jax. They would have taken him to surgery, dug into that, biopsied it, taken it out, and we might not have Jax. Right, Marnie? But you listened to your intuition. You basically fasted Jax. You put him into ketosis, and he's going to have revived life. He was probably given so much toxin in his short little life. He might have been a garbage feeder. You know, I think about Tallow. Tallow was on the streets in Norman, Oklahoma. His real name is Norman Tallow. He came as Norman. I've never gotten rid of that name. You know, I rescued him, and his name is, you know, long name is Norman Tallow. Norman Tallow is from Oklahoma, and he was running the streets for 2 years, approximately 2 years. We don't know. We don't even know when his birthday is. We made it up. We go by teeth. We go by their eyes. Those are ways that you can tell the age of your dog when you adopt a rescue dog. And Tallow, by the looks of his teeth, they were stained. He was eating garbage. And his short little life, he was eating whatever dogs are scavenger carnivores. If there is no meat available, they will scavenge and eat anything, including garbage. And so he was eating garbage. He was eating a lot of toxins. And now he's eating turkey and chicken and pork. Yes, they're monogastric animals. I get it. But you know, I feed my dogs more variety of meat. Like this week, we've been eating catfish. We put raw eggs on their meals, so they're eating raw eggs. You know, 1 a day. 2. Tallow, get this, loves tallow, and he loves butter. I can't even get into the refrigerator and he hears the wrapping on the butter, and he comes running. He loves it. And he looks amazing. His muscle mass, he was so skinny. His little butt bones were poking through his skin. You could see his spine. Now I can feel his spine, and he's developing glute muscles. He runs like the wind. This little whiphound of 15 pounds, he's amazing. He's so sleek in his fur, and I feel so blessed that I was able to rescue this dog from eating garbage to now eating. He's living a penthouse life of eating steak and catfish and organic chicken and organic eggs, and that's what we do for our dogs. And I'm so happy to see that, you know, your dog is thriving. And if you continue to starve those cancer cells, they're going to be at bay, and his immune system will be able to take care of the toxins. Romantic says, is the flu shot bad to take? Ask yourself why you need the flu shot. What is in the flu shot? Have you ever looked? One, find out, you know, wherever you're going to go get the flu shot, ask them, which flu shot do you give? Which one do you dispense? Well, it depends on what time, you know, what we order and what we get in. It could be different each time. Well, then maybe if you go get that flu shot, whatever, you Google it first and see and did you read the package insert? I mean, the whole package insert? My question is, what do you need the flu shot for? Is it bad? Well, I guess it depends on who's answering that question. A person who believes in flu shots will say, it's the best thing that's ever happened to me, and it's kept me from getting the flu. And same with my friends and family and my coworkers. If I get the flu shot, then I won't spread it to them. Or you could talk to somebody that says, have you ever noticed the chemicals in there from the package insert and the mercury and the this and the chemicals and the that, and it only has a 30% chance of working? And you'll talk to that person, and they'll say, why would you inject something into your body when you can just do it on your own? Oh, I've been sick. My immune system sucks. Well, why does your immune system suck? well, you know what? I've been told I don't eat very good. I don't exercise. I don't get out in the sun. I'm around a lot of LED lights. I'm blah, 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 blah. Then you know what? Maybe that person does need a flu shot. If you want to put chemicals in your body, get the flu shot. If you don't get the flu shot. But every medicine is a chemical. Every medicine is a chemical. Every medicine, either injected or orally or topically, blocks a normal biologic process going on in our body. It stops a normal process. If I give you a blood pressure medicine, I'm blocking a normal biologic process that your body is saying in order to get blood and oxygen and nutrients to the brain from the toe, I got to increase that person's blood pressure. And you go to the doctor, they diagnose you with some diagnostic test, and the next thing you know, you're on a blood pressure medicine, an antihypertensive, that's blocking a normal process in your body, and you call it good. Is it? Or was that defense mechanism of raising your blood sugar or blood pressure a reason why? You can't get blood to your brain, so your pressure went up. I'm just thinking logically. Are you going to find a public PubMed study what I just said? Doubtful. Because the people who make the medications would go out of business. And ask yourself, the most common besides a diuretic, hydrochlorothiazide, what's number 2 on their list of guidelines? An ACE inhibitor. An ACE inhibitor. An angiotensin converting enzyme inhibitor. It's inhibiting the angiotensin converting enzyme. Well, what do you need the angiotensin converting enzyme as a function in our body? Why would God have made us with an angiotensin converting enzyme? He made a mistake? I doubt it. But we're just going to give that, and it's going to just so happen to lower your blood pressure. What is the ingredients? How was that made? How was an ACE inhibitor made? What is one of the ways that you make an ACE inhibitor? Venom. Venom. From like snakes and reptiles and stuff. Venom. What about Wegovy? Venom. The Gila monster. Venom. What do we make injectables from? Venom. If you get bit by a rattlesnake, where are you going to go? Are you going to rush to the hospital to get the anti-venom because you know it's poison? But if I just put little doses in you, you're okay with it? Is that like just giving you a tiny little bit of cyanide over time? That's what doctors do. But what caused your high blood pressure? What caused your obesity? What caused your diabetes? Do we just give you some venom medicine? I'm just trying to get you guys to think here. Go look me up. I mean, go look me up. Ask yourself where all these things come from. I don't know. Lucy says, God bless you, Dr. J. Keep on teaching us. I'm trying. Bonjour from France. Hello. Eden says, I never eat plants anymore. How about wild salmon? What about it? I think on occasion, I'll eat wild salmon, but you have to admit they're romantic. Our waters, they're being poisoned. Everything that's in the air is going into our oceans. We got plastics floating in our oceans. You know, there's this, what is that group where they make the bracelets from all the bottles that they're pulling out? Something for sea? No, what is it? It's this group, this nonprofit organization. This nonprofit organization gets out of the plastics that have been thrown into our waters, and then they make these bracelets. And so if you buy a bracelet, you're helping them with their boats and their workers and all of that to try to get the plastics out. So yeah, all of that salmon And how big was that salmon? How big was that wild caught salmon? Did they feed you the big giant one that was alive longer and eating all the toxins? Or did they give you a little 4-pounder? There's just so many things. I just don't know the answer. But on occasion, romantic, I'm probably going to eat some wild caught salmon. I like it. Is there good fats in it? Yes. But I'm just not going to put, and I'm talking like once or twice a year. If I were to go out to eat, or if I go to someone's house and they have grilled salmon. But yeah, I'm just not going to do it. I'd rather choose a ruminant animal. Having some wild boar today, never had it before. Oh, Lucy, it's so good. One of my friends, they go to Oklahoma or Texas or those states where they wild boar hunt every year. Now that boar is eating wild foods, wild things. They're not being fed grains. Even though a boar is a monogastric animal, it's basically being grass fed. And so a wild boar is better than our domesticated boars that we feed grain to fatten them up and cause them to get diabetes, feed them full of lectins, and then we eat that stuff. I'm not going to do it. All of the antibiotics, they have to take antibiotics because they're feeding grains, which make them sick. They're getting illnesses. You guys. And Eden never eats fruit. Congratulations. Gazelle says, I thought you were vegetarian. Vegetarian? No. Dennis says, Baja Gold rocks. I agree. Lucy, is there a problem with Redmond salt? Yeah, they found high doses of lead and aluminum in it recently. Marty says, yuck to green bananas. Dennis says, get a cellular sizer. I want to thank all of you guys over on YouTube for joining in. I do appreciate it. But I can't read all of your questions. I do see one here. 50-year-old male starting carnivore, but on TRT with sunflower oil mix. Do I stop because of the sunflower oil mix? Well, you're taking a synthetic hormone replacement. You're putting in your body a synthetic. I would tell the woman the exact same thing. You're putting a plant hormone in your body. We are not plants. We're mammals. Now, you can take whatever you want, but the reason that your testosterone is likely low is because you have insulin resistance. You have metabolic problems. You weren't eating fat. You were eating a bunch of sugar. Your insulin level went up and you have body fat, usually around your gut. Your testosterone was low because you didn't have enough saturated fat to make testosterone. Then you had this little ovary in your fat around your belly. That's estrogen. And your belly fat is full of an enzyme called aromatase. So you're injecting yourself with your testosterone. Your testicles were trying to make it before. They couldn't because they didn't have the raw rocks and stones and tools to make it. So you and your doctor decide, I'm just going to give you some fake testosterone from a plant, which is a phytosterol, not cholesterol. And you didn't even think to get rid of the little belly ovary that was aromatizing the testosterone until now that you just start going carnivore. So start on carnivore. 30, 60, 90 days from now, wean off of your TRT and hopefully allow your testicles to repopulate, because I'm sure they're shrunk down from you injecting yourself with fake testosterone. Your testicles will shrink down like a raisin, and hopefully they will come back by eating enough saturated fat from animals. Because if you eat fat and cholesterol from an animal, you make pregnenolone. And pregnenolone will tell the adrenal gland to stimulate and make DHEA. And DHEA will make androstenedione, and androstenedione will convert to testosterone. And there you go. And it will stimulate your Leydig cells in your testicle to release some testosterone, hopefully. Okay? Just my thoughts on it, but you can do what you want. What are 5 top misconceptions regarding nutrition and ketosis that you've heard? top 5. Ketosis will cause cancer. Ketosis is not sustainable. Your brain needs sugar. So if you're in ketosis, your brain is going to get dementia. Is that 3? You kind of put me on the spot. It's things I'm not thinking about. Ketosis actually increases your blood sugar and causes diabetes. You get it from red meat. I mean, there's this, but those are the myths. Those are the things that you're going to hear. Sister says, what do you do for severe eczema and migraines? An anti-inflammatory diet, fasting, and low or no carb diet. I would also check your iron studies. Get a ferritin, a transferrin, a TIBC, and a serum iron level. If you got a question over on YouTube, put a Q in front of it. Otherwise, I'm just going past it. Okay. What is the better nutrition book in my opinion? Oh my gosh. I've read so many books. It just depends on what I want to learn about. If I want to learn about LDL and the cause of heart disease, I'm going to read books by Malcolm Kendrick and Paul Mason. And, you know, if I want to learn about hormone and thyroid, I'm going to read about Elizabeth Bright. If I want to maybe just get started on a carnivore diet, I might get Nutrition with Judy's carnivore book, or I might get Sean Baker's carnivore book. I mean, I've read so much. When I first started, the book that somebody gave me that really put me into a state of really thinking is The Big Fat Surprise. That was probably one of the first books I read, was The Big Fat Surprise. So read that one first. Lucy says, just watch the documentary Animal. It's on Amazon Prime. Check it out. I will. I haven't seen it. Where do you get fiber if you avoid fruits and vegetables? Bram, why do I need fiber? Why do I need something that I cannot break down? I don't have any waste if I'm carnivore. Very little waste. I'm using every single nutrient. My meat and eggs and fish and pork is absorbed in the small intestine. Very little gets to the large intestine. People who need fiber are people that eat crap that their body can't break down, and they have fermentation going on in their body. That's the bloating and the belching and the gas and all of that, and crappy bowel movements. They need fiber to help solidify and break it down and push it out. The reason you have waste is because you wasted a whole bunch of nutrients. So no, I don't need fiber. I don't have bacteria that break it down. They ferment it, they suck out the juice, the sugar, and then leave the rest. And that is your poop. Should I not eat nuts? Well, I don't know if you're a man or a woman, but if you are a man, I would never eat a nut, especially an almond. You're just causing yourself to be estrogenic. But nuts are full of lectins, and you're poisoning yourself. But again, that is up to you. And how to thin bile sludge? You have to thin bile sludge very, very slowly. You cannot just go from a standard American diet with a gallbladder full of sludge to a carnivore diet. It might be painful because when your gallbladder starts contracting, it's been weak. It's been weak and flaccid and floppy. That's why you develop sludge, because you were never stimulating it to work. So your gallbladder just laid floppy, and so the bile salts were being produced by the liver, were being stored in the gallbladder, but never being used. And then the gallbladder is just floppy. And then you start eating carnivore, which is higher in fat. Now your gallbladder is going to contract hard against that sludge, and that could cause pain. So you need to slowly add fat into your diet, animal fat, not liquid seed oil fat. That is going to cause worsening of your problem. So yeah, your gallbladder, if you have sludge, your gallbladder was not working. Abby, I've talked about protein powder early on. Don't do it. It is denatured amino acids. It's fake. It's processed. It's full of crap. I don't even care if they told you it's grass-fed, organic, blah, blah. Don't. Those are denatured proteins. They're denatured amino acids. They are going to spike your glucose. It's processed. It's been heated and cooled and frozen, blah, blah, blah. Just eat the meat. Get rid of the protein powders. Creatine, same thing. Eat the meat. You get enough creatine from meat. 5-6 grams. You know, a person who doesn't eat meat, take the creatine. How does blood type affect carnivore? I don't look. Everybody's a carnivore. Every mammal is a carnivore. We are mammals that are carnivores, believe it or not. You can tolerate eating plants, but yeah, we were. Adding fat, butter, tallow, ghee, lard, whatever the fat is that you want to choose. Well, if I'm only eating meat, how's my blood type going to affect how I'm going to process my meat? And is that just another gimmick out there? Is that just a gimmick to get you to go check your blood and just to eat plants? Are they going to tell you your blood type says, oh, all these blood types says don't eat red meat or else you're going to get poisoned? You're not going to absorb it. Everybody absorbs it. Your blood type means I'm under the impression, this is my opinion. This is not medical advice, by the way, which this is for information purposes only. And my information could be wrong, so go look me up. All right? I'm just trying to help you guys out. Even if I'm wrong, I'm stimulating your brain to work. But you're telling me that all the blood types of all the lions and the wolves out in the wilderness are going to say, ooh, my blood type is B negative. I better not eat elk today. Or I better not eat any salmon. That bear's got a blood type of blah. That'd be like telling the koala bear, oh my gosh, my blood type is this, so I better not eat eucalyptus, but it's the only thing we can eat. So do I eat the eucalyptus or do I just starve because my blood type says don't eat eucalyptus? Oh my gosh. Marnie says butter is okay for dogs, not too much fat. Just watch their stools, Marnie. When I say I give him a little bit of butter, honestly, it's even if he just gets a little niblet of butter, I'm talking like a half a pad of butter. Some days he puts it in his mouth and he's lick, and then other times, and then it's down the throat before I think he tasted it. That's how much he loves it. But if I tell him, go slow, then he does. Nancy, they do develop pancreatitis with high-fat diet. My dogs do not eat high-fat diet. They are eating, like their meat, I might eat the grease, but they're not eating the grease. And that's why I also give them chicken. Chicken is lower in fat. Turkey is lower in fat. And the pork is like 99%. It depends on what cut of pork you're feeding them. So do they eat as much ground beef as I do? Absolutely not. No, they don't. And Nancy, the little bit of butter that I'm giving tallow, I watch their stools, okay? I'm always watching. They do have they have formed stools. And, these are, I'm not, yeah. I think you guys get the picture. What are your top 3 meats to go on carnivore? I eat cow, deer, bison, and buffalo. Lara says flu shots are never good. All right, you guys. This was really good today. And see, once you guys get warmed up, you let me talk a little bit. Like we started out this session with talking about insulin resistance. And the more and more I talk, the more and more it sparks you guys to ask questions. And that's what I want to do. I want you guys to be active and we talk about these things. Like if you think, whatever, then we talk about it. I can give you my opinion. It doesn't have to be your opinion. But I think that I have a lot of truth to be given to you, and then you have to make a decision. So if I tell you all these things about broccoli, and being a goitrogen or whatever, then you have to make a decision on your own. I'm not going to tell you whether or not that your thyroid is going bad because you're eating all these goitrogens in cruciferous vegetables. That's up to you. But to say, well, I didn't know, that's what I'm here for. Because I would hate that 10 years from now, so I wish somebody would have told me that I was eating goitrogens and destroyed my thyroid gland. Yes, Maria, if you do not have a gallbladder and you start a carnivore diet, you should also go slow adding fat. And you might not having a gallbladder, you might need to eat small, frequent meals. I don't always promote that, but in a person who's just starting out on carnivore, you might need to eat small, frequent fatty meals. So your fat might look like a tablespoon or a teaspoon per meal. And then you just slowly build up. But eventually, you might have an outpouching of your common bile duct that will act like a storage place for bile salt. The small intestine is constantly secreting these bile salts in order for the liver to work. The liver is secreting them, right? Making them bile salt. And then they're usually stored in the gallbladder. But eventually, if the body knows that you're eating these types of foods, it's going to, it could form a little outpouch. It really could. Good chap says, you're so good. Thank you. You are too. All right, you guys. It is 11 o'clock a.m. in Iowa. It is a beautiful day, and the Iowa State game is on. And yeah, it's a rivalry. So we Iowans, we watch the Iowa State football game, and we cheer for the team that we love, and blah, blah, blah. I'm sure you guys know you have rivalries in your state as well. Now, with that being said, I will be back tomorrow at 10 a.m. on Instagram, and probably YouTube. Will give it another try. But I really think that the people over on YouTube, it will start fading out. And yeah, it'll be okay, you guys. So do your best. But I'll be back tomorrow at 10 a.m., Lord willing. You guys have a blessed day, and we'll talk to you later. See ya.